This is an educational video on how to use a ketone monitor to effectively manage a low insulin lifestyle. So how do we use these and why do we use them? Ketones are fuels that can help fuel brain cells, and they're only produced by the liver when the liver oxidizes fat for energy. And that only occurs when insulin levels are low. So ketones are an excellent proxy for fat burning. And the best measurement is to use a finger prick. But there are three main forms of ketones that are measurable. The main active form of ketones that we measure in the blood is called BHB, or beta-hydroxybutyrate. And this is the one that has most of the evidence for the effects on the brain and metabolism. Now, the most accurate way to measure ketones is a finger prick, and it's the same way that a diabetic would check their blood glucose using special ketone strips rather than glucose strips. Breath or urine measures of ketones, well, they measure the other two volatile forms of ketones called acetate or acetoacetate. And these can go up and down very rapidly, and that's why I don't recommend these. They can be useful, but I don't recommend them. For blood ketone measures, a measure above 0.5 is considered nutritional ketosis. Higher levels of up to 3 can be obtained in people that are getting high levels of fat oxidation, particularly when they're exercising. But levels beyond that don't seem to confer additional health benefits. Really high levels above 8 to 10 are associated with a condition called ketoacidosis, but please don't let a person without medical training convince you that this occurs with a low carbohydrate diet. Ketoacidosis does not occur with a ketogenic diet unless there is a severe deficiency of insulin, for example, in type 1 diabetes or the use of certain medications. Now, how do we measure ketones? We have a package containing a glucometer and ketone strips. And there's also lancets inside here, and this can easily be ordered online. There's different brands, and you can find a variety of different brands. Most kits will cost about $100 for a few months, and I have no commercial conflicts of interest. This is for patient information only. So to test your ketones and all your glucose, all you need to do is unpack everything. The first thing you need to do is load the lancet and set the depth that it will prick your finger to. So we open up, and from here, you just take the little plastic strip off. You take the top off, just a little pull away, and we find the little lancets, these blue guys. Open this up quickly. It's got a top that protects, and there's the tiny little needle. That's a 31 gauge needle, which is extremely fine, and we load it up. You then replace the top so that the little arrow is pointing in line with the lancet button, and it should just sort of click on. The numbers line up, and then you set the depth by rotating the top here. I like 2, I find that deep enough, but people with really thick skin on their hands might need to go a little bit deeper. But level 2 just flicks the little harpoon of a needle into you, and that's that. That's how you load it up, and pressing the button is how you fire the needle. I use these 2 fingers. I find they're much more comfortable and much better tolerated. And if you're someone with poor circulation, you can do a little Elvis arm swing to improve the blood flow to your hand before you prick yourself. Other things, we have the meter. The meter does not turn on until the strip goes in. And then we have the strips. So I'll open up this box of strips. And you get 10 strips in a box for this particular meter. They're the light purple colour rather than the dark purple colour, or the dark blue colour. So these are the ketone strips, and it's the same machine for both the ketones and the glucose. The only thing that changes is the colour of the strip as to what you're measuring. So the first thing is to load the lancet and set the depth, which we've done. The next thing is to get the strip ready. So I peel the strip, it's out and it's ready. The strip has 2 components. It's got a barcoded end, and it's got a paper strip end. The paper strip draws up the blood from your finger. You rest the strip in there. Once you push it in, the machine will turn on. If you get the strip and you draw up the blood from your finger and then put it in, it won't work. It has to be plugged in before any blood is put onto the end of the strip. So it's just poised and ready to go. And now I'm actually going to prick my finger. I'm a little bit nervous. So you pull back on the lancet, and there's the fire button, and onto the side of the finger. So we're ready to go. I like to use the side of these two fingers. They're a lot less sensitive. So I might just go here if I can. And here we go. Got him. And then you just give it a little squeeze. Okay. And then plug in. So we've plugged the strip in. Oh. What's going on here? Oh, I forgot to take one little extra step. We've got to pull this bit of plastic out at the back, just so the battery is now going to be unveiled, and now it's ready to go. So now we've got the strip ready, plugged in, and now it turns on. So there is no on button, it only turns on. And then you see KET for ketones and the little dropper, and it's ready to go. And that's just about enough blood that I've got there. And so we'll draw that up. Just enough, please. So when should you measure your ketones? The first thing to know about measuring your ketones is to be really patient. It takes at least 4 to 5 days for you to deplete your own body's carbohydrate stores. They're called glycogen in your muscles and your liver, to allow your body to switch to more efficient fuel, which is going to be fat. And patients who are more sedentary or living with pain tend to be more stubborn to producing those ketones and take longer, because the body prefers to burn glucose in the presence of stress hormones. So try measuring at different times of day, at least an hour after exercise and after food, and then find what works for you and keep it consistent. You should measure your ketones for 5 days in conjunction with the online food diary. And once you're in ketosis regularly, keep an eye on the ketones just a few times a week. Where can you record this information? Well, make sure you watch the low insulin lifestyle video and the low carbohydrate checklist, and then complete your 5-day food diary online just to get the most out of this. You can, of course, keep your own pen and paper diary, but if you do this online, it will help us manage you and it will come through to our practice. You can also keep glucose measures as well as ketones, and you can find out what level of glucose you tend to be at when you are making ketones, because they have an inverse relationship. Glucose, the lower your glucose, the higher your ketones tend to be. And then eventually you can monitor your ketones without actually checking that, just through measuring your glucose. Remember, these are just optional physiological checkpoints that can help you track your progress and keep you motivated. If you find this lowers your motivation or upsets you, take a break from measuring and just keep it simple and focus on your diet. And just to be very clear, just because you're making ketones does not mean you will lose weight immediately. The concept of fat flux means that you'll still need to be in a net efflux of fat, so that you're burning more fat than you're creating. And the way we should look at nutritional ketosis is as an opportunity for you to feel less hungry, have a lower appetite, and have the physiological improvements on appetite and insulin signaling. That will then be a springboard for weight loss.